Fantastic. Right, we're going to move into a panel of now experts that can help us sort of navigate some of the benefits we discussed, maybe a little bit of the industry, working closely. So I think what's always best for a panel like this is I'll get our panelists to introduce themselves, and that will give you the context of the role that you can play and add expertise in today. Now, I have loads of questions, because there's never a day that I don't, but the success of a good panel is always with the audience. So at any stage, anyone can raise their hand and ask a question. They can build on the conversation. So all I ask is I'll keep scanning the room, make it pretty obvious, and you can shout a question, okay? If you give me tumbleweed, it's just going to be us, and we're going to have a great discussion, but we'll never not always answer the questions you have. So if you have some, please ask them, okay? So just keep your hand at the ready to get going. So maybe I'll start with Katerina at the far end. If you give us an introduction to yourself, your role at Rousselot, and then we'll come down and then I'll get started with the first area. So please introduce yourself, Katerina.
Thank you. So my name is Katerina Silva. I'm the Science Integration Manager at Rousselot. And my journey with collagen started already doing my PhD. I actually work with biodesign collagen. So that was my PhD, where I learned a lot about this incredible molecule, all these different shapes, and so I studied until the level of amino acids, which made me fall in love with it. So when I saw Rousselot that does all these incredible products with collagen, I thought, okay, this is a perfect match for me. And I really love to do the integration part, which is, as you know, collagen can do so many different things. It's an incredible molecule, and I try to integrate and make a story out of all the different potential of that the collagen molecule has to offer. And now, especially in nutrition, we see all these incredible benefits for sports nutrition. So I'm learning a lot about sports nutrition also with our partners. And the goal is really to integrate and make the messages, like you saw with Florencia presented, as easy to understand as possible, and to engage our consumers into buying these products that can really help, whether they're sports or physical beauty, that it's also very important. So that is my role currently at Rousselot.
Brilliant, thank you. Hans?
Okay, thank you. My name is Hans Zwerver. I'm a sports and exercise physician. I work at Gelders Vallei Hospital, which is rather close by. Furthermore, I'm a professor of sports and exercise medicine at the University Medical Center in Groningen and the University of Groningen. And I'm excited to be part of this meeting. Thank you for the invitation. My work, on the one hand, deals with exercise is medicine, which is also closely related to nutrition, I believe. And on the other hand, I see a lot of patients with injuries, but I also do scientific research, especially in tendon injuries. And that's my link to Rousselot. At the moment, we are running a trial in which we supplement collagen. We can talk about that a little bit later.
Let's not blow my thunder yet. That's an important area, but perfect.
Yeah. And next to this, I'm the chair of the Dutch National Center for Exercise Medicine, and I'm also in the editorial board of the Dutch Journal for Lifestyle Medicine, which also combines a lot of topics which have been addressed with nutrition, exercise, sleep, relaxation. So I'm happy to hear and share my ideas and open for your questions.
Great. And you juggle in your spare time, or?
Yeah, that really is a great. It's a workout, but it also relaxes your brain. Yeah, and you let loose something, and you have to catch it again. It's a very nice way to deal with lifestyle things. And there are also very nice booklets about this topic, what it means to your brain. You go from the left to the right side, and I can really recommend juggling. Yeah.
I did not see that answer coming, by the way. I just thought it was a great picture and thinking you were going to go, yeah, I love to juggle. But then actually, when you say that, I'm like, what a great answer. I'm going to go home and juggle, and left and right brain. Yeah, let's do a demonstration. Tom, please.
So, good morning, everyone. So it's difficult to almost introduce yourself when the name's on the screen. Trying to think what else I can say that's not there. But So my name's Tom Clifford. I'm a lecturer and researcher from Loughborough University, which is in the UK. It's well known for sport globally as a university institution, but I think it's quite difficult to pronounce outside of the UK. And we've had Luga Baruga is quite common, or Laubrau, that's also quite common. But just to give you some context, it's right in the centre of the UK. If you know where Leicester or Nottingham is, it's basically in between those two. My work there focuses most of my research work is on dietary supplements generally and health and exercise performance. As I suppose from Florencia's presentation recently, you've seen that I've done some work in collagen peptides. I also teach as well, I lecture. We have a postgraduate course on physiology and nutrition of sports and exercise, so I also teach students on that course. We have about 50 or 60 students on that course each year.
Brilliant. Perfect. So as you can see, we've got Tom who can, of course, talk about his research and some of the work that Florencia put up onto the slides. So we'll be able to ask some questions around that. Hans, a lot of the sort of real-life sort of stuff around injuries and tendinopathies and the research he's doing there. And Katerina as well from an integration communication point of view and the knowledge of collagen and the peptides. So it's a place to start, Katerina. Actually, the problem with panels, right, is they are at the behest of what I asked them. And we created a nice thread, but I'm already going to start with something I didn't even write down. So Katerina takes the first question. But I promise you, I think it's a sensible one. So there was lots presented today, and Florencia did a great job in putting the benefits up there. Everyone in the room, in their own role, will work with brands or customers or trying to communicate the messages out there. So as a starting point around collagen and collagen peptides, where's the biggest body of evidence? Like, where should any brand start thinking about collagen and sports nutrition that gives them that most robust sort of platform for a great sort of product or opportunity with athletes? Where should we start first? And I know there's other benefits to come, but where do we start first with where we know the most and we think the benefits are the strongest?
Well, first beauty, of course, but which is also important, like you mentioned, to look pretty. But in terms of really sports, I would say joints. There's a lot of evidence, although it's in vivo, so on bones. So everything that requires your, jumping, it requires more fine movements as well. I would say that that's where the most science is. So really cartilage-related issues. So that's what collagen is known for. So the science really started. What is collagen famous for? For bones, for joints, for cartilage, for tendons. So most of the science is there. So actually, it's for sports nutrition is not really a big. It's not that complicated, I think, to explain why you need to take collagen.
Do we, as it stands from your point of view and understanding the category and how well communicated, do people really understand it? I mean, how well do people understand the benefits of it? To us, it feels obvious, doesn't it? It was the answer I expected, but have we fully maximized that opportunity?
No, but with collagen, I'm not sure you will be ever to fully maximize, to be honest, because it can do so many different things. Like Florencia mentioned, it's the gut, it's sleep, it's joints. So you can basically, it's the molecule that it's everywhere in your body. Every cell, really every cell from the immune system, from your heart, from your everything reacts to collagen and responds to it. So it does so many incredible things that I think for sports nutrition, it is a key protein.
So to some extent, its real benefits, the fact it can do so much, is almost inhibiting its ability because people could use it anywhere. So maybe everyone in the room helping to find that focus would be really useful.
I think for recovery, I think we all remember that whenever you feel sick, if your grandmother gives you a chicken soup, you immediately feel better. So everything that it's all these nice broths that bring that you have in the memory, that when you get sick, that's recovery. So, and peptides is really a more efficient way of doing that.
Yeah. Well, I'm glad you mentioned sort of injury as a starting point, because that enables me to bring you in as a perfect segue. Talk to us about, I think, the context of injury. So you're working with athletes a lot, and you mentioned you got some research there. But before we delve into the research, just give the context to how often are athletes injured? I mean, is that one of the biggest things that stops athletes training?
Yeah, for sure. Yeah, it's a big issue, of course. There are many injuries in athletes, and then I'm not only talking about professional athletes, but also the weekend warriors, who do running once a week in the weekend. Yeah, that's an immense problem. And I mentioned my expertise is in tendon problems, but half of all the runners, so 50% of all the runners, experience Achilles tendon problems once in their lifetime. So 50% has to deal with Achilles problems once during their running career. And there must be runners in this group, and maybe they recognize this. But for example, these Achilles tendon problems are very common. If we make a sidestep to, for example, volleyball, to elite volleyball, our hospital is also linked to the elite volleyball, Olympic volleyball players here at Papendal. And about 80% of these professional athletes has changes in their patellar tendon, which is the tendon just below the knee. It's called the jumper's knee. And about 40% of this group experience pain. They continue to play with pain. So it's a kind of occupational disease for them. But that shows how many athletes deal with these problems. And it's not only the athletes who come up with these problems, but also the people who exercise because of the health benefits. They are at risk for developing problems to their joints, to their tendons as well.
I mean, 50% is a lot of people.
Yeah.
I always think it's quite fascinating. I'll come ask you. It's just that we talk about some of these things and think they're quite niche, but actually when you unearth a lot of the statistics, particularly in injuries, it is a lot of people that need some support.
Women more prone to patellar problems.
Good question.
Slightly wider hip, which means it's not tracking quite straight in bend with slightly narrower hips.
Good question.
Sorry, I missed the start of the question.
Women.
So men have slightly narrower hips, which presumably means the patella tracks slightly more straight, because we're a bit more straight down from the hip to the foot. Women have slightly wider hips, so there's more of an angle. Does that affect?
Yeah, there are gender differences when it comes to sports injuries. Another example is ACL, anterior cruciate ligament. With the increasing popularity of women's football, there is a high risk for ACL injuries. There might be a role for collagen as well, but that has to do with the anatomy. And you're completely right in general. And I have to be careful because there are women in the audience, but they have a wider pelvis. Their knee is more in valgus position. They have less muscle power in quadriceps and glutes, which increases the risk for example, knee problems. So that's true.
Brilliant. And just before we talk about your research, give people an understanding. So when you say 50%, and we can talk about what's the extent, when you say they have problems, what does that mean? That goes from a certain percentage would have a rupture all the way through to just, I call it, the word I use is niggles, which I've been told is a very English word. So, you feel a bit sore every now and again. It's annoying, but it doesn't quite stop me. But maybe, what's the continuum of tendon problems? What are we dealing with?
Yeah, that's those little problems till a complete rupture.
Yeah.
Fortunately, the complete rupture is the end stage of degenerative disease. That's not that common, but there is a whole group with these small complaints. But you can continue to participate, but if there is a disbalance between load and loadability of your body, the pain will increase. And many athletes and people who are exercising for their health, they continue to exercise, and the pain will in the end increase. And then it's very difficult to get rid of these symptoms. So we have to intervene in an early stage to prevent it from that terrible stage for which we don't have a excellent miracle treatment, which helpful. So treatment of tendon problems, and it's the same with cartilage problems, always takes a long time, and it can be frustrating both for the athlete, but also for the doctor or physiotherapist who has to deal with it. So it takes a long time to recover. So it's symptoms of long duration with not a miracle solution, so that makes it challenging.
Yeah. And I think that's an important point, that sometimes people frame injuries in a almost a ruptured or an end point that stops people exercising, but actually injury is a very much continual daily thing that people are dealing with. And I think the interesting concept there for me, just to build on, is the idea of trying to be better in terms of the protection or the pre-bit to try and help not just manage it, but to make it better. So maybe, again, that takes us into the work you're doing. So Hans, maybe explain the study that you're doing for everyone in the audience.
Yeah. I already mentioned the jumper's knee, or in medical Latin it's called patellar tendinopathy. It's a common injury in jumping sports like volleyball, basketball, and we don't have a good cure for this problem. The cornerstone of treatment nowadays is load and pain management. So reduce the load to these athletes. Sometimes we intervene with measures to reduce the pain, but on the other hand, we do strengthening exercises to improve the whole kinetic chain in loadability and to make these tendons stronger. And in this study, on top of this strengthening program, we add collagen supplementation. So it's a randomized trial in which we compare strength training with collagen, and we compare it to strength training with a placebo. And we do a follow-up for 1 year. And look at all kind of outcome parameters, of course pain, function, but also ultrasound examinations and all kind of pain measurements. So it's a broad randomized control trial.
That sounds great. So where are we in that? Are you in the middle of this full year? Sorry, did I miss that bit if you said it?
Now we have started the inclusion
Right.
5 months ago, and we have now included 28 athletes, and we need 76 athletes for this study, and it doesn't look that much, but in patellar tendinopathy, this is one of the bigger studies which have been performed so far.
So I guess it's a case of watch this space, but in essence, it's quite unique research, isn't it? Because it's very real world, high applicability.
Yep.
Is this a preventative study? So is this about prevention, or is this about what? Because prevention versus cure, right? That's not great words for our industry, cure, but just go with me because we're not being regulated right now. But is it prevention or cure? What is this?
I think we call it secondary prevention.
Okay, good term. I like that.
The athletes have a problem. As I've mentioned, they often continue to play their sports, but with these interventions, we try to reduce their symptoms or even remove their symptoms. But once there is a tendon problem, you can't. There is no definite healing, so you have to take all the measures to make it as comfortable as possible for the athlete. So I think it's somewhere between secondary prevention and treatment.
Wow, I don't know. Is that optimistic or pessimistic? Like, sorry, it's going to live with this, but we're going to make it better. It's kind of it's a bit like that, right?
Yeah.
Wow.
Yeah, and if there are changes in load, there always is a chance that symptoms occur again.
Okay, we've got a question back. I'll keep this going. René?
Yeah, would you say that the problems you described in the jumper's knee is also a way of having a sort of a chronic inflammation? And if so, would then be in addition to working with collagen, you also looking more into, let's say, the postbiotics, regulating your immune system, trying to get down this chronic inflammation?
Yeah. Yeah, there is increasing evidence that low-grade inflammation is involved in many chronic diseases, also of the musculoskeletal system. So osteoarthritis and tendon problems are also related to chronic low-grade inflammation. That's true.
Good question. So I think this is really important. I mean, like super real world. Go for it.
Yeah, so my question was related to the story of Hans, who talked about sports that have a lot of impact on the ligaments, on the bones. I work in cycling, and that's on the other side of the range where you have almost no impact. Do you also see a lot of problems in that population? And how do you see the role for collagen, for example, in preventing injuries?
The specific problem of patellar tendinopathy, I don't see it often in cyclists. I think you're completely right. I had some cyclists with Achilles tendon problems, but it's as you mentioned, a completely different load to the system. But I think there must be a role for collagen in cyclists as well. We saw the broad scope which it can bring, for example, in recovery during multi-stage cycling events. But I think the importance for tendons is less. But in my experience, also long-term cartilage problems occur, for example, in the knee in cyclists. So there definitely is a role in cycling as well. But the focus is a little bit different.
Just quickly before you do this, and then I'm absolutely going to bring Tom in because he's here for a reason. Curveball on that. What about wound healing? I mean, surely the rate of serious wound healing problems in elite cycling, particularly, must be one of the biggest challenges they face. I mean, I don't think you see a Tour de France, do you, without 2 or 3 major events? And I've never seen anything worse than someone coming off a bike at that type of speed. So, do we know much about wound healing and collagen skin? I mean, where do we play? Obviously, you're not going to fix the skin overnight, but nothing does. But should we be doing it in that space?
Yeah, wound healing for sure. It's one of.
No one talks about it like that, do they? I don't feel like it does anyway. But anyway, sorry, Katrina. Yeah, Katrina.
Yeah, because collagen is still seen as just connective tissue, and of course, but wound healing is a big part of
that process.
Yeah, of that process. So it does help with wound healing. We have. A lot of times with collagen, when people know we work with collagen, they just come with anecdote, their own experience.
Yeah.
And there's for example, for cycling, one of our consumers just said, I don't know why, but I just feel that everything is smoother. And we're very happy. It works for them. For other people, they had a wound that refused to heal, and when they start taking Collartics, then the wound heals. So we don't have clinical studies for all of this, of course, but we do see that a lot of consumers are reaching out and telling us even things we didn't thought it was. So in our, when they send us a message saying this worked for me, or so that's also very interesting for us to know, to have this feedback from consumers.
Yeah, not just that, but actually a really rich place to understand that is just to see some of the comments people leave on brand websites. It's less about the scores they give. There's some facilitation there, but actually the genuine N of 1 anecdotes are really super powerful, and sometimes in our industry a way of navigating nutrition and health claims. Not that we are trying to navigate it, but positively embrace N of 1 case studies and anecdotes is really important. James?
Yeah, I've just got a question actually more about how collagen works. My understanding is, obviously there's target specific, there seems to be some ones that can go towards the joints, but the studies I've read, it seems to be that you take it for the skin. It's actually not the collagen that you're consuming going to that site. It's actually doing something else in regarding the body then metabolizing more collagen. Is that how it works in the joints as well?
Let's do the 101 of collagen mechanism of action or something here.
Well, the funny thing about collagen is that it works in many mysterious ways. So one of the big benefits of collagen when you take collagen peptide is that you get, when you eat peptide, your body further digests the peptide into amino acids, so building blocks, and bioactive collagen peptides. So when these bioactive really tell your body what to do. And so it's like you have a Lego box where you come with all the little pieces, the building blocks, and then you come with the instruction manual that tells you what to do. And that's what bioactive peptides do. They're just the instruction manual. Now, different body tissues will receive that information in different ways. It can be something like for skin where the collagen peptides actually reach the skin. For other, through the blood, for other tissues where they're less vascularized, so there's less blood flowing, there's other ways that it happens. Sometimes what occurs is that the collagen gives a message to one cell, that cell gives a message to another cell, and so on, and that cascades until the joints, for example. So it's really, it's a way of transferring information around the body, and it's like each tissue has its own way of doing things, but it seems like everything works, and collagen really gives information to the different tissues according to how they perceive that information. So that's the interesting part. That's why, I mean, it depends, yeah.
Let's segue from injury into recovery. So, Tom, what do we mean by recovery?
I knew you were going to ask that.
But also maybe then take the lens of how you defined it, of course, with the study. But let's just take a contextual approach and then move into the study. Would be good.
Yeah, in recovery, I think is used as a be-all kind of holistic term, really. And from an exercise or sports point of view, you can be recovering from several different things. So recovery is very holistic. So it could be recovery of the immune system. It could be recovery because of sleep loss. It could be recovery of your muscle and connective tissue from the exercise that you've done. So there's various different ways that you can use the term recovery. And I don't know, but I presume consumers probably think of recovery in that context of just feeling better, feeling like they've recovered after that workout. It's that getting back to baseline or where you were before that workout or before that event or whatever that might have been. In the context in, say, a lab, when we're often studying it, so in the context of the study that Florencia talked about earlier, I suppose academically, this sounds negative per se, but we often call recovery in that context exercise-induced muscle damage, which I know sounds a little bit terrifying, but as Florencia showed, we asked individuals to do 150 drop jumps, which is quite a lot. It's from 0.6 meters in height, and it's a fair amount, and it does a good job of the next few days. You feel pretty sore and it's pretty uncomfortable. And the reason we do that is to stimulate a response, so an inflammatory response of some kind, to stimulate soreness, to try and get soreness levels that are reflective of anyone who has ever done really hard exercise at the gym, or anyone who ever done novel exercise, or they've been injured and they've just getting back into the gym again. And I'm sure everyone in this room has at some point done some exercise and for the next few days thought, God, my legs, what have I done to myself? Is pretty typical. And we call this exercise-induced muscle damage not because we're causing severe damage, or we hope we're not, but we are causing some form of small damage so that our body can repair itself and be stronger for the next event when you do that. So in the context of that study, what we were looking at was very much the recovery was about recovery in terms of, can you feel better in terms of soreness or delayed onset of muscle soreness, because it normally peaks a couple of days after the event, but also can you recover your strength as well? Because interestingly, most people recognize the soreness part, the DOMS, the dreaded DOMS, the delayed onset of muscle soreness. But most people won't be aware that when they're feeling those symptoms, their strength won't be as good as it is as well, because you don't necessarily test your strength the next few days. It's really easy to walk downstairs and say this feels more painful, but you don't actually test your strength, but you won't be quite as strong. And from an athletic performance, this is a problem, not only because athletes tend to train daily, sometimes twice daily. I can't even imagine how many times gymnasts train, but I'm sure it's quite a lot. But then some athletes compete as well every 2 to 3 days, particularly in competition scenarios. Football or soccer is normally the archetype for this, where you've got 2 to 3 days turnaround before you've got to perform again. So from a sporting context, often what practitioners and athletes are after is what can get me back to baseline as quickly as possible. And that's the way that we typically study I suppose, exercise recovery in a lab type setting.
And just for my memory, actually, and probably for the audience, the subjects, how elitist were they, or how often were they exercising? So I guess I'm trying to understand. Obviously, there's a real elite application, but
Yeah.
I guess presumably this is a very active application as well, isn't it?
Yeah, so this is very much more probably closer to your weekend warrior, I suppose. It's individuals who go to the gym 3-4 times a week, maybe a little bit of jogging, a little bit of cycling, but not elite athletes. Partly because you can't get elite athletes into the gym to do those types of things.
And just remind me, how quickly do people feel better? Like, what was the time point response, or when it becomes significant? Like, how acute how acute are people feeling better? How quickly, sorry?
It's the next couple of days afterwards. It's normally 24 to 48 hours afterwards. So I think there's a misconception that recovery immediately post-exercise is more fatigue. That's slightly different.
Yeah.
So it's just feeling tired from what you've just done. Whereas delayed onset muscle soreness or recovery in the kind of longer term context doesn't really peak until 24, 48 hours post. Hence why it's normally, if you go to the gym, the next morning's when you wake up and think, oof, okay.
So I was just laughing at the fact I have an MSc here, which by no means I'm a scientist. So my plebeian science question talks about adaptation or treating symptom versus cause, and you need soreness for adaptation. So where do we come on this? We're reducing the soreness, it's pretty good. Hey, I want to make consumers feel better, right? We all do. That's what our industry is, to exercise. But where do we fit on the, because we'll talk about anti-inflammatories and so on. So it's a can of worms, but this is important for the consumption of collagen, and it's maybe mechanisms of action, etc. So the whole, what do we want to treat? Are we doing the right thing? And so on.
Yeah, and I don't think you need soreness to adapt. The whole kind of no pain, no gain is a myth. You do not need that soreness to adapt in any way. I think from a practitioner point of view, what we normally look for in terms of sports performance is very much, I suppose, it's trying to get them back to that baseline in that short period. So it's more strategic. So I suppose this is where maybe this differs from what we're talking about in terms of tendons, where it might be more daily, chronically over several months that you would require it to get these adaptations. From a recovery point of view, it could be that you've got a really important match or event on the Saturday, so you want to start supplementing with collagen prior to that and after that, because at the moment you're feeling a little bit sore from training. So you're going to push yourself strategically depending on how you feel. So I think that's one way that you can look at it. So there is that more perhaps strategic use around when you may be a little bit sore, or good examples might be you've had a lengthy layoff from the gym for whatever reason. Yes. Perhaps you've been injured. You're going to go back, and the next few weeks you're always going to be a little bit more tricky. You're going to feel sore. It's going to be more difficult. So you can, I suppose, depending on the context of why you're consuming collagen, it could be more strategic, or it could be more longer term.
Yeah. But there's a fine line between conceptually there. I'm thinking about people starting to get to grips with starting a marathon for a reason. That's unaccustomed exercise. Then you're talking about recovery, but it might be that we're facilitating recovery, but there's a protective from a tendinopathy point of view. How do we conceptually define that? Because actually from a communication point of view, Katrina, that must be quite difficult. I don't know if my question's clear.
Well, no, I mean, I would say I would come back to the adaptation point, and I know the point you're making, and a lot of that is if we provide supplements in some kind of way in concentrated doses, are we negating some of the positive cell signals that allow us to adapt? But I think that is probably not really associated so much with protein, collagen, amino acids, and it is very much more associated with, I suppose for a better term, but the superfood type category, so the more antioxidant based category. So I think it's not something that is probably of a huge concern, I would say, on the collagen side of a supplement.
Just going to ask that question, but it was going to be two questions. Sorry.
So probably 20 years ago, people started questioning the blunting of the adaptive response with antioxidants, and I guess from what you're saying, that's perhaps not an issue with substances that actually help us repair. Secondly, most recreational exercisers actually exercise in the evening after work, which is quite close to bedtime, and I think the stress of exercise affects our sleep, and so perhaps is it a happy coincidence that we might take peptan or a globular protein like whey protein at bedtime to help us sleep and repair when growth hormone's high? And I guess, does whey help fill the gap that peptan might not be able to provide? Because it's not a globular protein, I don't think, is it? Collagen.
No,
So it sounds like a nice combination. So I guess I'm asking, are there optimal times where we might make best use of the proteins we take after exercise as everyday recreational people?
Do you want to have maybe Katrina, do you want to answer that? Try.
I don't mind.
Of course, it's something that we're also very interested about. This we all have a circadian cycle, which means some food you take or some activities you do are optimal at certain times. And we also want to study that, of course, where is the best time to take collagen. And sometimes it seems like it also depends on the outcome you want. So for sleep, it seems like if you take it 60 minutes before going to bed, it seems to work and to yield results. For other activities, it might be better in the morning, but it depends also in the end of the outcome you want. But it's something that we also want to have into consideration is for our future studies is when is the best time.
I might be asking a very similar question then, because I've kind of gone, right, I could consume this for the purposes of sort of, I think at 50%, I reckon even more would disclose higher some sort of tendinopathy, tendon issues. You've got a recovery point, which you could take immediately, but I guess you took some time in the period after training. And then if that happens to be when most people train, either first thing in the morning or after work, and then you're hitting the pre-bed, was it all 20 grams of the collagen? Do we have a horses for courses, i.e. we need to take a different amount for these different endpoints? What can we communicate to the audience around, because in my head I'm going, well, I just take 20 grams of peptan and actually I'm going to be covering off my tendinopathy because I get sore. I'm going to cover my recovery because I exercise. And if I take it actually on a daily basis, but within pre-bed, I'm literally, I'm suddenly back to the elixir word, which I try to avoid, but at the same time, the beautiful collagen or the beautiful protein is doing a lot for me. So I guess, do we need to be a little bit smarter than that, or is that too simplistic?
No, I think they can answer better than I can, but I think also depends on which stage. If you want prevention or recovery, the dosage, I think you also recommend different. What do you normally? I can imagine that also men, women, that might be.
Good. Well, what do we recommend for dosages, timings? Tom, and then we'll go to Hans.
Yeah, I think that the most pragmatic way to look at it from a dosage point of view, probably almost regardless of what it is that you're trying to do it for, is that if we know that from a bioavailability point of view, the amino acids and the peptides, they increase or they peak around 30 to 60 minutes after you consume them. So I think before there's been more research to understand exactly when's the best time to take them, you want them to be in your system. So let's say, for example, it's a recovery point of view. We provided it before, 30 to 60 minutes before, so that these amino acids, the peptides, were in the system when they were performing the exercise. You could equally argue that you could perhaps do it post-exercise, and we did do an extra post-exercise dose as well, because if they are having an anti-inflammatory effect, for example, which was one of the things we were investigating at the time, again, inflammation peaks quite early post quite strenuous exercise. So you want to try and make sure they're in the system for that. And then again, sleep, because they're peaking around an hour post-intake, and what we were principally interested in the sleep study was seeing how quickly individuals could fall asleep and stay asleep. That was when they were taken. So I think there's also, and I guess some of the early tendon and ligament work that's been done is again similar, where it's having them in the system, so consuming them an hour before, having them in the system when you perform the exercise, and it's the combination that should help. So I think
if there's an endogenous production effect, then it helps to have it already there, available, rather than taking another 2 hours to be absorbed into the system, doesn't it?
Yeah, I mean, that's probably the best way that I'd look at it. And if you were being, I suppose, taking it more holistically over a long period of time, because studies have shown, and I think that's a difficult one at the moment, because studies have shown 5 grams could be beneficial for certain aspects, and some studies have used 30 grams, so you don't quite know the optimal dose. But if you are looking at, say, 10 grams in the morning if you were exercising, so you could have it 10 grams an hour before exercise, around exercise at least, and then you could have 10 grams before bed. So that almost that split dose as well enables you to make sure that you're topped up, as it were, in terms of these peptides. I mean, this is very much me trying to use what science is available for what kind of pragmatic approach I would take if I was recommending it.
But very useful.
Yep.
But more work to be done. That's okay, because
Yeah,
we're in the right room for people who
absolutely.
will facilitate that work. And
Yeah.
of course, the more we learn, if we all knew everything, it'd be a bit too easy, wouldn't it? So I think we've got to keep moving with this. And as Tom actually did a really good job, has tried to credibly apply logic to the way I think people can do it. And I think in a lot of these instances, do no harm as well. And as far as I'm aware, we don't do any harm, do we? Or maybe you just want to confirm that, Katerina, like as in, there's only really, you know, whilst we still need to better refine what we need to know, actually the consumption is still a positive thing, right?
Yeah, that's really key.
And go on, Hans, you go.
I think when it comes to communication, we have to be fair as well, because many injuries have a multifactorial etiology, and I think nutrition and collagen is one part of it. But if you want to run a marathon, you have to have a proper training schedule. Otherwise, you get injuries as well. So I think it should be part of a broader approach, and it can be helpful, but it's not the complete solution to all injuries or all problems in the medical world. So I would like to stress that, but there definitely is a place for collagen, but we have to look at the whole picture also in the communication.
Yeah, there's some really interesting things. That's the one thing we've touched on sleep a little bit. Let's come back to the evidence, sort of the evolving base around the gut. Just Tom, just to answer that maybe, or to start that process. What do we know about the rate and frequency of people who are suffering some of the symptoms that lead us to want to see benefits? Like how many people are having gastrointestinal disturbance or intolerance? What do we know about that? How much of it is increased with intensity of exercise? I guess contextually, what do we know about facts and figures? What's the problem we're solving, or extent of the problem?
Yeah, it's probably wider than you know, and it's been reported that up to 50% of particularly runners are the ones who seem to suffer from gastrointestinal symptoms, and a lot of that can be basic as, and I don't know if this is a term, just a UK term of stitch, but you know, general, where you've got painful feelings in your abdomen somewhere. So symptoms related to gastrointestinal stress are definitely greater when you're running as opposed to cycling, so that seems to be more of a problem. It seems to be more of a problem as the intensity gets greater as well. It's more of a problem if your nutrition is generally poor, if you're dehydrated. That's also more of a problem. We restricted fluid intake in the study that we did because we wanted people to exacerbate those symptoms. But generally, it is quite widely seen, and it is quite problematic, and it can cause quite a lot of problems when it comes to exercise.
Yeah, and I think we spend a lot of time on this, and I think the more you get underneath this, a lot of again, people try to put it into niche buckets, but the reality is there are a lot of people exercising, there are a lot of people doing events, and actually the rate and frequency of challenges that they face, whether it's tendinopathy, whether it's gastrointestinal disturbance or intolerance or whatever it might be related to, is actually, it's not niche, it's actually very mainstream, as in there's a lot of people who suffer from it. And but the challenge with the gut is, and I've used this a lot more recently, is helping people break the poo taboo. People don't always want to tell people about it, actually. But more people are actually challenging the communication of it. So there is actually work doing around the communication. So if there's a phrase you remember, break the poo taboo. And Florencia mentioned about whether anyone in the room, I'm not sure you'd ever admit, has that story. I actually ran the Bath Marathon. And it wasn't me, but I remember following around mile 18, and I remember just people going, what's that? And then realized that we were all running towards someone who was running sort of slower, and they'd had an accident. Fair play to the person, because they just kept on running, but they'd had that accident, and it was pretty obvious. And it actually is almost in every marathon, half marathon, you will sadly, visually see it in real life. So it is that rate is pretty high. So what do we know of, like, where does collagen fit in? Because everyone will define, like, they'll go pre, pro, post being the new kid on the block. Like, where does collagen fit into this? Because I know we've seen benefits. Can we succinctly describe what we know about where it fits in?
Is it from a GI perspective or
Yeah.
just generally?
No, I guess through the work that you've done, where does it fit in terms of its potential role to play in solutions?
Yeah, it's a good question, and I think probably what's been shown so far is that we investigated in terms of recovery, we then looked at GI, and then we looked at sleep. So I think we're still very much at this stage where it's still kind of the new kid on the block, and we're still trying to work out. So hence why we've been looking at in different areas like this. So it's quite hard. At the moment, we've found some positive results in each of those studies, but it is quite a broad base. So I think it's still quite a challenge. And if you look at something like whey protein or milk proteins generally, they've been studied for 40, 50 years in the sports nutrition field. It's not quite the same with collagen. So the evidence base is still being generated. If you would ask me a question about dosages for whey protein, everyone knows it. It's very established, but we're still not there with collagen. So a lot more still needs to be done in that context, which is what we're doing at the moment. So yeah, from a general point of view, it is still being developed, but as with all research, the findings are generally equivocal. There's not all positive findings, but I think if you take the consensus of all the studies at the moment, there is some good evidence to suggest it could be useful with tendons, ligaments, general connective tissue, perhaps recovery from exercise and also sleep, etc. So the evidence base is being built that it could have, I suppose, benefits broadly for sports and athletic performance. But yeah, I suppose that's a really long way of saying I think it has applications in sport, but concretely it's trying to say where and how is still being developed.
And I'll bring Katrina back in a second. On the area of the gut, which you've done, if you were to pitch today for more research funding, where actually do we take that research next? Like actually, where is of the work you've done, how do we evolve that so the battery of evidence continues to move in a positive direction? Obviously, assuming we would test assumptions are correct, but how would you look to develop that work?
Yeah, well, with the gut one particularly, we looked at individuals who didn't have gut complaints. They were all runners, fairly good VO2 max, fairly fit individuals. We made them do 70 minutes of running on a treadmill, and it was quite intense at the end. But I think looking at individuals who have got actual diagnosed issues when it comes to gut complaints, or they actually are symptomatic, I think there needs to be more of a push to look towards them, because they're the ones who are most likely to benefit, theoretically at least. So I think if you were pushing down the gut, it's really saying, well, who has these symptoms more commonly, and if we provide collagen peptide to them, will it be more beneficial for them than individuals who don't identify with that symptomology?
Hans, I'm going to ask you a question, and so to sort of finish off and come to Katrina, like where would you like to see the research in collagen evolve? Like what are the key questions that you feel you'd like to see answered to improve your knowledge and practice? And then of course I'll finish on Katrina for that question as well.
I think that's in line with my previous remark about a little bit more consensus about dose response relationship, and also the more insight into the working mechanisms behind collagen. So that there is an area. It looks very promising, but there is an area which needs to be elucidated.
Yeah, brilliant. Katrina, you don't need to have the mic. How do you, does Rousselot see the future of sort of where do we need to go in terms of research into the areas of collagen, particularly around benefits, or might be to do with dose? How would you describe where we're going to take it?
I think in this particular area, we're going to go into different fronts. So we have the clinical trials, where we really want to understand the mechanistic effects of collagen. How does it work? So that's why we work with our academic partners. But we also like to know how athletes use it, and do they feel better? So there's a more real life studies that we also want to do to the future, because clinical trials are excellent to measure the efficacy, to see if it works or not, and how, but normally they're limited. the people that do the studies need to take time out of their lives to do it. So you already have a smaller pool of people that can join the clinical trials. They normally have the same age, gender, because you want to standardize, of course, as much as possible. But the world out there is much bigger, and there's all these other people that do exercise, and we will also like to hear from them. So we are also developing new platforms, new ways of engaging with those people and asking them how do they use Peptone, if it works for them and how. So Colartix that we done with Lake Chemicals was a great example. And I think that's also the way to go. Does it work in real life? Like when you run the marathon, does it still work? Or even if you didn't change anything else in your life, if you didn't control for everything, does it still work? So I think those are very two important things for us, the efficacy and the efficiency of a product.
Brilliant. Just before I sum up, does anyone have one final burning question at all?
Sorry, everyone.
No, go for it. Just
So it's really
gastrointestinal distress. I think we need to define intensity, because it seems to me to be endurance that causes the issue, a time period that leads to it, because you don't see footballers who run around for 90 minutes rushing off to the toilet, but you see Paula Radcliffe crouched in the Olympics after a similar period of time. So is it depletion of glycogen and the like? That is there a point, or is the stop-start nature of team sports perhaps not such an issue?
yeah, what do we?
Sorry.
Yeah,
Sorry. I should say that I think it's probably been misrepresented, gastrointestinal stress, a little bit, that everyone's thinking a little bit about accidents that may happen.
Yeah.
But actually that's a very small part of
just
what we mean by gastrointestinal stress. So a lot of it's around, it could just be general flatulence, it can be abdominal pain is typically the bigger problem. So it could also be nausea. So it can be, some people actually, get heartburn, all of these. So it's more, I suppose, collective than just thinking about that. But yeah, there is less data, absolutely, in team sport players, but they do still suffer from similar type problems. But yeah, not so much the rushing to the toilet one, but gastrointestinal symptoms, yes. No, you are correct. Yeah.
It's like it's almost like the continuum of the tendinopathy from rupture to whatever. You've got an extreme aspect through it to flatulence or bloating at the most frequency, and I guess you'll see a higher frequency of some, of which for a lot of it isn't as visible to people watching sport as obviously something else would be, and I think that's probably an important thing. But it's a really important point actually to really frame that people don't go away thinking we're trying to solve people taking an urban poo basically, versus lots of other challenges. So good question. Just to summarise, because it's amazing how quickly an hour goes. I always think an hour's a decent thing for a panel, but it goes bloody quickly. I think actually we've had a lovely discussion that really frames, interestingly, a lot of the work in injury. Well, that actually almost feels as much a protective prevention approach as much as a response to being injured, let's say. A huge area there, and of course you can drop onto that. Maybe there's even a higher risk for females as well in certain situations. We didn't even talk about age and menopause, which we did last night over dinner. That might be quite interesting as well. And then you seamlessly move into this whole aspect of facilitating and accelerating recovery, which is not just an elite challenge, it's an everyday challenge, isn't it? Because actually, arguably, more everyday people face unaccustomed exercise more often. I guess it's that whole load balance that Hans talked about. So that's really interesting. And then all of a sudden you find yourself talking about a pillar related to sleep. You talk about a pillar related to the gut. And then we're back to this challenge of consensus, which is, God, it does quite a lot of things, which is super positive. But as a collective, we need to keep these conversations going. And I'm sure Gaten and Francia have got the vision to continue to consolidate these conversations for the point of helping us create consensus around that. But I guess if you're going to leave with one message today, it's I guess the excitement of the opportunity and the role collagen can play. And I guess now, having had this discussion, it very much supports the reason why actually out there brands in this area are looking to innovate in collagen. I can see that through our data. I think they just need more conversations with everyone in this room to help us facilitate those great benefits. So I guess it's kind of one of those sporting analogies. The baton is over to everyone else in this room to take that on. So thanks for your participation and questions. It always makes for a better panel. And of course, please give our thanks to our panelists for their contribution.